So the surgery we're going to be setting up for today is a femoral nailing procedure. This is where a nail is inserted into the femur after a break for a fracture. For the information that we got from Jomi, the patient is positioned on a fracture table. So this picture you can see how the patient would generally be set up. Our setup is a little bit different just because we didn't have a fracture table at our disposal, but just so you can get an idea of how a patient would actually be set up for this procedure.
So when coming in to the OR, this is your first stop where you're gonna get all your PPE. So you're gonna get your shoe covers, your mask, your goggles, and your
Hairnet.
And then we have this red line where it tells you the division. So this is semi-restricted and this is restricted area.
Alright, so when you're assessing traffic patterns for a sterile field, you want to look at where things will be before the procedure starts. So in this case, all of the supplies are in these cabinets here, so you want to keep this to be a dirty area or a dirty traffic area so that the circulator is able to come get supplies and give them to the surgical tech. For this procedure, we have the anesthesia in the head. In the preoperative phase, the patient would not be draped yet. So that leaves plenty of space to have people around the patient before it is considered a clean area. And then also leaves for preoperatively for the sterile field to be as far away from the traffic as possible, because all of the traffic will be from the doors around the patient, and then the only traffic towards the sterile field will be the surg tech while they're setting up.
Okay, I'm going to talk about another dirty traffic area, sub-sterile. It contains supplies, and we also have autoclave that we use that we can sterilize equipment and gather other tools.
So once you're in the intraoperative phase, the only traffic that should be going anywhere even to the head of the patient would be the circulator giving things off to the surgical tech as needed.
Okay, so we have a suture. Expiration date is good. There's no holes.
Expiration rate is good. Package integrity looks good.
Thank you. Go and check the package. Okay. Package integrity is good. Thank you.
And then once she is away from once she is given off the supplies that she needs to, she will then get away from the sterile field, and the surgery will progress. So once we get to the post-operative phase of surgery, this is after the incision has been closed. The surgical tech will move her sterile field and sterile items away from the patient in order to keep the sterile field sterile and all of her instruments sterile until the patient is out of the room. Once the patient is undraped and out of the room, that's when we can officially start to break down the sterile field. But until that happens, we want to keep dirty traffic above the head, just like how we did during the intraoperative phase.
All right, this is where the tables will be set up preoperatively. So I'm going to go ahead and move on to where they will be for during the surgery. We're going to have the Mayo stand over the patient. And then we are going to the lab table. Right in front of the man standing next to the patient.
So I will be playing the role of the circulator in the OR part of the team that is a non-sterile personnel. My placement in the OR would be near supplies and up to, for our sake, where anesthesia is set up. So I can pass supplies as needed without breaking into the sterile field.
One.
I am playing the role of the anesthesiologist. I'm here at the head of the table to make sure that the patient's airway stays good through the procedure and make sure all vitals are good.
And then I would be the surgeon in this scenario. Since we're doing a surgery on the femur, it would be in this region of the body. And then I have
The surgical assistants, which my job will be consisting in helping out the surgeon with the procedure.
And I'm the surgical tech, so I'll be in charge of all the instruments and painting of the instruments. As well as making sure the sterile field stays sterile.
Because the operative site is not near the head of the patient is pointed towards the door to keep anesthesia personnel and their equipment, which is non-sterile, towards the doorway, making everything by anesthesia to the doorway the dirtiest, busiest non-sterile traffic areas. So their movement doesn't disrupt the sterile field. Another busy traffic area would be classified as along the walls. And near any supplies where the circulator is moving back and forth, again coming up to where anesthesia is to not disrupt any sterile field. And then when it comes to the location of the sterile field, it would be towards the middle of the room to maintain the laminar airflow, to minimize airborne microbes and reduce the risk of surgical site infections. And then where our fields will be set up and oriented for the procedure, it would be just this way here, with the Mayo stand over the patient and the back table right here ready for use for everything prepped and ready for the selected procedure. And then this is the finalized setup for intraoperative use for our specific